Consider two scenarios. Scenario number one, where you have back pain, mild low back pain, not very severe. For the last 2 to 3 days, it hasn't been going away. It's gradually increasing. It's mild in nature, nothing severe. But you don't know really how to manage it. It's not constant, it comes and goes, and it's when you do certain movements. Okay, scenario number two. You have severe back pain, lower back pain, and this continues all day long. There's hardly any time where you don't have pain. This pain could be either across the lower back, it could be going into your buttock and into your leg. There could be some tingling, numbness, things like this. So if you are in scenario number one, or somebody you know is in scenario number one, then this video is for you, because I only recommend home self-treatment for lower back if it is scenario number one. For anything that is a little bit severe, or if you feel that it's not going away for many days, then this is something that a medical professional should look at. So let's get into lower back pain and how you can self-treat this at home. I'm Dr. Rajni Patil. I'm an orthopedic and sports specialist, and I've been practicing for the past 18 years. My clinic is called Orthosports Physiotherapy, and it's at Shivaji Park. Today's video, I'm going to talk about low back pain. We can't really get into a lot of the causes of it, but I want to talk about mechanical low back pain, and I'll tell you some most common causes of it. And I want to show you just 3 simple exercises that is fairly safe for a lot of you to do. Even if you don't have any back pain, these are just good preventive back exercises to do. Let's talk about mechanical back pain. This basically just means that you have pain in the lower back. It could feel like a spasm, it could feel tightness, it could feel just pain, but this pain is usually, it comes and goes. You could have time of the day that the pain is worse. It could be with certain movements, or you've just not thought about it, but really it's important to know which are the activities that bring my pain on, which makes it better. But let's look at the primary causes why mechanical back pain happens. This is very common. It's coming from either your daily postures, how you're sitting at home, how you're sitting at work. Are you sitting for too long without taking any breaks? Are you investing in a good lifestyle for lower back, which is, are you walking at least 3 to 5 times a week? Are you running? Are you doing some core exercises? Are you doing Pilates? So are you working your lower back muscles? Are you working your core muscles? But also it could be as simple as just abusing your back by doing awkward positions and awkward movements very frequently. So you may not know about these, but it's better that you are aware of this through the day. Figure out how many times you're bending forward, for example. All day long, I tell this to people all the time, all day long you're probably bending forward a lot and not even realizing it. You're slouching a lot. So because you're not aware of it, you continue to do this and it becomes a habit. So getting out of that habit is important. For example, in the kitchen, bending forward to take some stuff, if all your stuff was at this height and maybe above you, then that's better than you having to bend forward a lot. This is just at home. At work you could apply the same things. So these are some of the primary causes of lower back pain, which can be treated by a physiotherapist really well. If you have any severe back pain, don't do any of these exercises. Definitely talk to your doctor before you do them. But everybody else who has, a little bit of low back pain that has just started, scenario number one, remember, if that's you, then definitely you can do these exercises with me now. Get into the 3 exercises that I want you to do with me. The first exercise, this is my favorite exercise to do, and I like this exercise because I feel we bend forward a lot, like I told you before. So start thinking about how often you are bending forward. But this exercise negates a lot of that forward bending and that slouching and things that we do all day long and don't even know. So let's do this exercise. So at least do it with me and do it right. Every exercise, I cannot emphasize this enough. It's not enough that you do exercise. It's important that your form and your technique is absolutely correct. If that falters somewhere, you could be setting yourself up for an injury. So let's do the first one. This one is called backward bends. So basically you're going to stand, you're going to put your hands behind your back like that, and then you're going to bend backwards. Okay, the mistake a lot of people make with this exercise is that people want to bend their neck backwards also. So if you are doing that, then it makes your whole body sort of unstable. It's better to look at something in front of you, keep your neck straight, and then go back. Okay, so again, for this to be effective, try to go backwards as far as you can. Take it to your end range. Don't push, don't bounce. Just stay for about 2 seconds. This one you don't have to stay for very long. It's not a stretch really. It is basically just a movement. So go back as far as you can and come back. Do 10 repetitions of this one. This is a really good exercise to prevent back pain, but also if you have some niggling back pain right now, it's fairly safe to do. Okay, so let's look at exercise number 2. This one is called pelvic tilt. So let's do a pelvic tilt. You can do this in lying down, sitting, or standing. The easiest way to do it is really in lying down. However, I'm showing you the sitting one because in sitting it's easier to do in sitting in the way that you're sitting all day long, so you don't have to separately go lie down and do that exercise. You can just do it while you're working at your desk, right? So the pelvic tilt, it looks like this. Basically you're going to be sitting in your chair, a little bit ahead in your chair, and then you're going to tilt. Keep your back nice and straight, your ear over your shoulder, nice and tall, and then you're going to tilt forward, which means that your lower back arch increases, and then you tilt backwards, which means that your back goes into a C curve. So you're going to tilt up and you're going to tilt back. So tilt up and you're going to tilt down. So this basically what it does is it keeps your spine not stiff, so it keeps it mobile, it keeps it flexible. And this exercise, a lot of my patients say that even if they don't have time for anything else and they've done this particular exercise along with the backward bend, it has really helped their back pain. So these 2 exercises definitely do with me. The third one that I like a lot is called a cat camel, and I'm going to put a picture for you so that you know which exercise this is, but it's a very common one. I'm pretty sure all of you know this one. You do these 3 exercises on a daily basis. If you have a little bit of back pain, I would recommend you do it twice a day. Right after you do these exercises, put an ice pack for about 10 to 15 minutes on that area wherever you have pain, and that will really help your back. I hope these exercises were helpful to you. Back pain is a very big topic, and actually there is so much that you can say about it. There is mattress, there is posture, there is so much. But I just want to leave you with 3 facts about back pain that nobody can ignore. Fact number 1 is that back pain tends to be episodic. What does that mean? It means that once if you've had back pain, then the chances of it coming again and again are high. So which means that with every episode your back pain could be slightly worse than the other. And I say this because I have experienced so many patients who come to me after their 5th episode of back pain, and they all say the same thing, that my first episode was really very mild and then every episode kept getting worse. So it's like a warning signal that has been sent to you, but you really ignored it, you didn't do anything about it, and now it could have become a full-fledged disc prolapse, slip disc. It could be n number of things, but don't let it get there. So that's fact number 1. Fact number 2 is that once you have back pain, especially a severe episode of back pain, you always need to be careful, because that lower back area that you had a problem with becomes a little bit vulnerable for future episodes. Okay, so you may want to think about changing your lifestyle, changing your things that you do through your day to manage your back pain. You should take up a set of exercises that you learn from somebody trained and credible, and do them lifelong. Make walking and swimming a part of your lifestyle. Do things like that so that you can remain pain free. Lower back pain will not come to your life again, ever again, but it is a fact that you have to manage it lifelong. And the fact number 3 is that if you've had back pain, the more you delay treatment, whether it is self-management or whether it is seeing a doctor, the more you delay it, the worse it is for you. This is true with any pain, but for lower back pain especially, this is very, very, very true because it is so episodic and because it has already become vulnerable. So definitely don't ignore your lower back pain. Do something for it right away. Start with ice packs and the exercises that I showed you. Again, if it is in scenario number 2, if it is not getting managed by the first few days of self-management, then you must talk to your doctor immediately. We are also available on call. We can take a call and help you exactly what steps to take once we consult with you online. So you can reach out to us on our website, or the clinic number will also be there in the bio and the description.